An osteopathic practitioner can help in so many different ways because we are working with the body, with the muscles, the joints, the nerves, the arteries.
We attempt to take in as much information about the body as possible in all its systems. So we don't narrow it down to only looking at, for example, musculoskeletal system, or the nervous system, or the circulatory system. We are trying to understand the person in their entirety. How do all these systems work together to cause the problem that we're seeing manifesting in the person?
So you can see an osteopathic practitioner, obviously, if you have an injury that you need dealing with. Osteopathy can be really helpful for chronic pain and really complex issues.
Any spinal problems that would include the neck. We're looking at TMJ dysfunction, where we can help headaches, we can help muscle strains and sprains, we can gently mobilize joints, we can help with the digestive system, the circulatory system, menstrual dysfunction. We treat pregnant women, we can treat children. We treat all of these things. Many people will benefit from osteopathic treatments, especially if you've tried a lot of other modalities. There's great modalities out there to help us these days, but if you're not getting better, give osteopathy a try because we're going to approach the problem in a different way, okay? And we've got a myriad of techniques, and we're very gentle and we're very present when we're working because we're listening with our palpation skills to the body.
I use my hands because they're fantastic tools. The sensitivity in our fingertips is just incredible. It's so precise and accurate. We're practicing all the time with our palpation. Every time we put our hands on a patient, we're thinking, working out how we can use our hands to help that patient. It's like developing a fine touch for pottery, ceramics, things like that, to mold and craft and use your hands well, because that's what's going to get the patient better. That's what really separates an osteopathic practitioner from many other professions, the way that we use our hands.
The essence of how we're able to determine what we feel within our hands. Our refined palpatory sense, we're able to feel what bone feels like versus muscle, versus organs, versus the endocranial tissues, the brain, or the dura that surrounds it.
What a patient can expect on their first visit, I would hope, is a warm welcome. A welcome into a safe environment for treatment.
I like being an osteopathic practitioner because of the depth of experience that I get to share with my patients. I find that because I'm treating on multiple levels, physical, emotional, mental, that it allows a very deep range of caregiving to an individual. This is often reflected back to me by my patients, which is a remarkable gift. I feel like it's actually a privilege to be able to do this work, and I'm honored to be part of a tradition that has very generously handed down the information.
Any patient that I work with, I feel that there's definitely a give and take relationship. They come to me with their problems or dysfunctions or whatever's bothering them, and for me, I take away one new thing that I've learned. Every treatment to me is so special because each person and each session that they have is almost like a brand new, page in a storybook. So you're kind of learning something from each person.
And then once we get into the treatment, as we know, osteopathy is entirely a hands-on treatment, and we have a whole variety of techniques that we use that are tailored to the individual. It's not a set program. Every person that comes in to see me is treated as an absolute individual.
What we tend to do is look at the strain pattern that's in front of us that the patient presents with, but as you peel that back, you find another layer and another layer, and so you can trace it back to the actual cause. And if you can get to that cause with the honed sense of palpation that osteopathy uses, then you can really help people, you can really help change their lives.
One of the things I love about osteopathy, and I'll use Suzanne Langner's quote here, if we want new knowledge, we have to get us a whole world of new questions. And I think that osteopathy has and continues to ask those new questions. in the way that it looks at the body and the philosophy surrounding our treatment.
There's so much more that with osteopathic treatment we're able to look at, even just outside of the physical body. When I'm talking about the structures and the fluid systems and these cranial systems, we actually bring in the patient as a whole into their treatment. So we include who they are, what makes them who they are, underlying emotional or psychological barriers sometimes.
We have a variety of different techniques that have become very popularized: visceral osteopathy, craniosacral therapy. They are most effective if they're used under the umbrella of a complete osteopathic philosophy. We do have a wide variety of techniques as well. There is a scope of osteopathy from more robust, moving the patient around, massage and mobilization, to very, very gentle, more ethereal kind of treatments like the cranial osteopathy. The beauty of it is that within that scope there's pretty much something for everybody, from the newborn to the elderly to sports enthusiasts, football players, weekend warriors.
Usually as an osteopathic practitioner we're not going to be focusing directly on the area that helps, but we'll be looking at the whole body from top to bottom. There's an old osteopathic saying, don't treat the smoke, treat the flames. So sometimes you may say, I've got a low back pain, but quite often, particularly in Whistler, I find the low back pain comes from an old ankle injury that hasn't been resolved, so we need to assess that as well.
Osteopathic treatment is very gentle. You may touch some tender spots in the body, but everything is always within your pain limits. Afterwards, you may have a day or two of soreness. But it's more akin to if you've been to the gym or you hadn't been to the gym in a while and you were working some muscles that you hadn't used in some time.
A patient might choose osteopathy over another health modality because maybe they've already tried other modalities and they feel that they need to try something different. So osteopathy can probably really bring something different to the table.
I'd recommend somebody choosing an osteopathic practitioner because it works. We work hard to get our patients better. We enter into a patient partnership where we work hard to get them back to doing what they really want to do. I don't like to stop people doing how they want to live their life, what they want to do. So I do my best to, and every osteopathic practitioner that I know does the same thing, to get their patient back to where they want to be without putting restrictions on them, but working with them.
A person should try osteopathic treatment if they're not getting better with what they're currently trying, or if they haven't tried anything yet, try osteopathy because, of course, in our opinion, it's great and it's highly effective.
It's a profession full of people that care for your health, want to get you better. Give it a go. If you're finding that something else hasn't worked, come in and see an osteopathic practitioner.
What I enjoy about being an osteopathic practitioner is the ability to make a profound difference in people's lives on a daily basis.
If you have tried a number of different disciplines and you haven't found the answer you're looking for, osteopathy may just be that answer.
All I care about, and I know all my colleagues truly care about, is you getting better.
Many insurance companies do cover osteopathic treatment. In order to find out if yours does, contact your employer, your human resources agent, or go directly to the insurance company to see if they will cover you for osteopathy. If you're looking for an osteopathic practitioner in your area, please go to our website, osteopathybc.ca, and look for the member listings.